Hi friends out there, today let us learn something from the public health dentistry. So what do you think about oral hygiene maintenance among children? Don't they need special care? And if you sow a seed of how to maintain oral health at an early age, won't they cherish the fruits of it as an adult? These thoughts led to the development of school dental health programs. There are many such programs across all the countries. Today let us see about an historically important dental health program, the TATTLE Tooth Program or the Texas Statewide Preventive Dentistry Program. It was developed in 1974 to 1976 as a cooperative effort between Texas Dental Health Professional Organization of the Texas Department of Health and Texas Educational Agency together through a grant from the Department of the Health and Human Services to Bureau of Dental Health. The program was pilot tested in 1975 and field tested in 1976. In 1989, the Bureau of Dental Health developed a new program to replace the existing TATTLE Tooth program called as the TATTLE Tooth II, a new generation for grades K6. So let us see what the program contained. Separate lessons are developed for each grade. It consisted of 3 videotapes. The first videotape was to familiarize the teacher with lesson format and content. The second videotape had brushing and flossing techniques. It had a dual purpose. First, as a teacher training tool, the second one as an educational unit which would help the teacher to train the student. The third videotape provides teacher with additional information of how to help and teach lessons. They also provided a brochure which provides an overview of the program, and a school nurse's brochure was also provided. The program's philosophy and goal was oriented towards 6 elements of effective lesson design. It included the anticipatory setting the objective, input modeling, checking for understanding, guided practice, and independent practice. Then the program was implemented. How did they implement it? The Texas Department of Health employed 16 hygienists in 8 public health regions. The hygienists instruct the teacher using videotapes. The teachers are encouraged to invite dental professionals to demo brushing and flossing. Then field trips for kindergarten children are also planned. Then health promotional activities are encouraged and publicized. Thus, the program had a philosophy, goal, and was implemented. How the program was evaluated. Program evaluation was done among the students in grades 3, 5, 11, and 9. They were given the Texas Assessment of Academic Skills (TAS). Major field test was conducted in 1975 and 1976. The study was among 15,000 children in 18 educational service districts. The result of the single exposure to program revealed that the dental health knowledge is increased in all grades. Plaque control was reduced to about 15%. Then 80% of the teacher judged program to be helpful and effective. So the program was almost a successful one. In 1989, a statewide summative evaluation was also done. In that, they found that teacher and student interaction was present as a result of the format of the program. Students respond to curriculum were positive or very positive. Then 94% of the teacher felt teaching oral health can have a positive effect on children's dental health habits. And so, that was how one of the historical important school dental health programs were carried out. Stay subscribed and connected by pressing the bell icon to get information on more such important questions from the public health dentistry and other chapters of dentistry.